You're tired all the time, even after 8 hours of sleep. Your skin itches for no reason. Your urine looks darker than usual. Your legs feel a little swollen by the end of the day. On their own, none of these seem connected. You might blame stress, dehydration, or just getting older. But what if all four were actually messages from the same organ, sent in different forms because something deeper was going on? By the end of this video, you'll understand exactly how a single organ can produce 11 completely different warning signs, and why most people miss every single one of them until it's too late to ignore. That organ is your liver. It performs over 500 distinct functions inside your body, from filtering toxins out of your blood to manufacturing the proteins that let your blood clot properly. But here's the strange part. The liver itself has very few pain-sensing nerves. That means it can be damaged, inflamed, even scarring, and you won't feel a thing. No alarm bells, no warning ache. Symptoms only show up once the damage has already started affecting how the liver functions, which is exactly why doctors call it a silent organ. So let's walk through what your body is actually trying to tell you. The first sign is persistent fatigue, the kind that doesn't improve with rest. Your liver converts the food you eat into usable energy and stores glucose for when you need it. When liver cells become inflamed or damaged, that energy production slows down, and waste products that should be cleared out start to build up in your bloodstream, leaving you running on empty. But that's only the beginning. Loss of appetite often comes next, sometimes paired with unexplained weight loss. A struggling liver disrupts the normal digestive signals your body relies on, and chronic inflammation itself can suppress hunger. Most people don't realize that unintentional weight loss, especially without dieting, is one of the first things doctors ask about when liver disease is suspected. Then there's itching, often deep and relentless, with no rash to explain it. Here's where things become fascinating. Your liver produces bile, which helps digest fat. When bile flow gets blocked, a condition called cholestasis, bile salts back up into your bloodstream instead of draining into your intestine. Those salts irritate nerve endings in your skin, and the result is itching that no lotion can fix. That same blocked bile flow explains the next two signs together. Dark urine happens because bilirubin, a yellow pigment normally cleared through bile, gets rerouted into your bloodstream and filtered out through your kidneys instead, turning urine the color of tea or cola. Meanwhile, your stool can turn pale or clay-colored because the pigment that normally gives stool its brown color never made it into your intestine in the first place. Two opposite color changes, same root cause. Easy bruising and bleeding is next, and this one surprises people. The reason lies deep inside your liver's role as a protein factory. Your liver produces most of the clotting factors your blood needs to stop bleeding, and it requires vitamin K to do it properly. When liver function drops, clotting factor production drops with it. So even minor bumps leave bruises, and small cuts take longer to stop bleeding. Swelling tells a similar story. Your liver makes albumin, a protein that keeps fluid inside your blood vessels instead of leaking into surrounding tissue. Without enough albumin, fluid escapes into your legs and ankles, causing visible swelling by the end of the day. When that same fluid imbalance happens inside the abdomen, combined with increased pressure in the portal vein that carries blood to the liver, it can cause the abdomen itself to swell, a sign called ascites, which usually points to more advanced liver disease. What's even more surprising is what happens to your eyes and skin. Jaundice, the yellowing you've probably heard of, happens when bilirubin builds up faster than a struggling liver can clear it. Most people notice it in the whites of their eyes before it becomes visible on the skin, because the tissue there shows pigment changes earlier and more clearly. The liver's influence even reaches your brain. When it can't filter ammonia, a byproduct of protein digestion, that ammonia builds up and crosses into the brain, causing confusion, forgetfulness, or noticeable personality changes. Doctors call this hepatic encephalopathy, and it's one of the clearest signs that liver function has declined significantly. Finally, some people develop spider angiomas, small clusters of blood vessels visible on the chest, neck, or face that look like tiny red spiders. They're caused by hormonal changes that happen when the liver can no longer break down estrogen efficiently. Here's the most important thing to understand. Fatty liver disease, alcohol-related liver disease, viral hepatitis, autoimmune conditions, inherited disorders, medication-related liver injury, and cirrhosis can all produce these same symptoms. Having one of them doesn't mean you have liver disease. But if several of these signs show up together or persist over time, it's worth getting checked. The encouraging truth is that many liver conditions are treatable, and some are even reversible, especially when caught early. Your liver has been quietly working for you your entire life. Understanding its warning signs is the simplest way to work for it in return.